Let's talk about how our muscles respond reflexively during spinal manipulation. One important idea here is the reflexogenic effect of muscles, essentially a built-in system that helps protect the body from potentially harmful forces. According to Evans in 2002, our bodies are equipped with reflex arcs that trigger muscular responses when a joint is under threat. These reflexes create coordination between the active muscular system and the more passive joint support structures, like ligaments and capsules. This interplay helps to reduce pain, ease muscle tightness, and improve movement function, as discussed by Potter, McCarthy, and Oldham in 2005. Manipulation of the spine is believed to activate these muscular reflexes. Weick pointed this out back in 1979, and since then, several studies have backed up this idea. Research from Herzog and others in the 1990s, as well as Simons and Suter in the early 2000s, demonstrated that spinal manipulation can trigger muscle responses both near and far from the manipulated area. For example, Koloka and Keller, in a 2001 study involving 20 patients with low back pain, observed measurable EMG responses in muscles following spinal adjustments. Interestingly, patients who reported frequent pain had more pronounced reflex responses than those with only occasional discomfort. So there's solid evidence that spinal manipulation causes muscle contractions through reflex pathways, especially via sensors in the joint capsules and muscles. Still, it's unclear whether these reactions are directly caused by the manipulation itself, or if they might come from some other element of the therapy, as Potter and colleagues noted in 2005. Now, let's consider how manipulation might influence alpha motor neuron activity. It's been suggested for a long time that back pain leads to overactive, tight muscles, and that spinal manipulation could help relax these muscles by modulating nerve activity. More specifically, alpha motor neuron activity. Evans again raised this idea in 2002. However, this theory still lacks strong scientific support, and not everyone agrees with it. Some of the earlier research, like studies by Gillette in the 1980s, proposed that high-velocity thrusts during manipulation can stimulate pain receptors, but only if the force actually reaches the joint capsule and surrounding tissues. Ahern and colleagues in 1988 partly supported this idea, but they also found that many patients couldn't achieve enough movement during flexion to trigger the necessary neural response. Letterman in 1997 raised concerns about this theory, arguing that a sudden stretch from a manipulation is more likely to stimulate, rather than inhibit, motor neurons. On the other hand, Dishman and Bulbulian in 2000 found evidence that both manipulation and mobilization could temporarily reduce the excitability of alpha motor neurons. They suggested this might be how manipulation calms overly active muscles. Still, we need more data to know for sure. Then there's the idea of gamma motor neuron involvement. This goes back to a theory called the facilitated segment, proposed by Core in 1975. It was inspired by even earlier EMG research in the 1940s, which found that painful spinal areas showed increased muscle activity. A more modern study by Lehman, Vernon, and McGill in 2001 confirmed that spinal manipulation can decrease the EMG response to painful stimuli. Based on all this, Core suggested that a painful spinal segment leads to increased gamma motor neuron activity, which in turn increases alpha motor neuron excitability and muscle tightness. Manipulation, he believed, could calm this system by improving joint motion and flooding the nervous system with signals from muscle sensors. Although we still don't fully understand the nerve pathways behind this effect, the role of sensory feedback, or proprioception in spinal function, is drawing increasing interest from researchers, like Picard in 2002. Still, this theory isn't without its critics. Potter and colleagues have argued that it remains debatable whether patients with back pain even have this kind of facilitated neuron activity in the first place. Moving on, another major theory is the pain gate mechanism. This idea comes from Melzack and Wall in 1967, who suggested that pain perception is regulated through a gate-like system in the spinal cord. In the dorsal horn of the spine lies a layer called the substantia gelatinosa, or SG. Pain signals from small diameter nerves, the A delta and C fibers, open this gate. But signals from larger diameter nerves, the A-beta fibers that carry input from muscle and skin sensors, can close the gate, essentially shutting down the pain signals.